Hello, my name is Brittany Perez. I'm a social and behavioral health major at the University of West Georgia. This is part 3 to assignment 6. So starting off with education for chapter 16, the lecture highlights, formal and informal methods of learning, and formal being like actually structured schooling and curriculum, and informal being like the passing on of cultural values and norms, which is called cultural transmission. And this doesn't necessarily have to be verbally, it can be non-verbally as well. And and then it goes into the theoretical perspectives on education and what it looks like in functionalism, conflict theory, and symbolic interactionism. And so with functionalism, education is looked at as a social institution and the core of society that was highlighted in lecture 6. And so there are 2 functions on education that functionalists view, and that is the manifest, which is primary, and then the latent, which is secondary functions. And so with the primary functions, that's going to be referring to like social control and socialization. And then whereas like the secondary functions on education would be like networking and political and social integration. And so that's functionalism. Also, social mobility is one of the primary functions. So with conflict theory, this is focusing on what the lack of access to education materials in lower and working class neighborhoods looks like, and how it reinforces and aids in keeping around social inequalities. And so then it goes into symbolic interactionism and basically labeling theory in action, and what it means to be labeled, which is also highlighted in lecture 6. And the textbook expands on the issues within education and the struggles with equal education for lower income students, because they often struggle with insufficient learning, and the issues behind No Child Left Behind. That was a federal law, I guess, that used higher test scores as more of a financial incentive to receive more federal funding. And so I highlighted that one size fits all just cannot apply to education, and that is true. And then it highlights the students with disabilities and how they experience significant disparities among within the quality of their education, and that's based on race, ethnicity, and their location. And then school choice, public, homeschool, and private, and then the remote and hybrid learning that saw a jump during the pandemic, and how, the overall data behind that shows more negative consequences and outcomes. And then chapter 17 goes into government and politics and power and authority, and how, sociologists have a different approach and are more interested in the influences of governmental power and, the effects of power locally, statewide, nationally, and globally, and how it can affect based on an individual's socioeconomic status and the social conflicts that come along with that. And then it talks about power, and it highlights Max Weber and from 1922, and he was talking about how power is the ability to exercise an individual's will over another, and how power can affect more than personal relationships, and it just affects like everything. And so then it goes into the types of authority, and then the textbook defines authority as an accepted power. And there's like traditional, charismatic, and rational legal power. And traditional can be looked at in like maybe monarchies, which is a type of government listed. And then we go into the forms of government, and they talk about monarchy, oligarchy, dictatorships, and democracy. And the lecture highlights that democracy is not perfect. And I will agree on that. So the theoretical perspectives behind government and politics and the economy. So functionalism is up first, and this explains that the government has, 4 main purposes, and all of those involve just enforcing norms, directing society, law and order, maintaining and meeting social needs, and the management of relations internationally. And the conflict theory talks about the power elite in the government and how they use the government to keep policies that allow them to stay elite and keep their wealth. I think that was C. Wright Mills, 1956. He wrote that, or something similar. Sorry, he didn't write that exactly, but very similar. And how modern day conflicts still, what still drives them is, the desire of power and wealth. And so there's the conflict theory perspective. Then it goes into symbolic interactionism. And this basically focuses on figures in the government and politics, and their importance, and how they represent power or authority, and both at the same time. And it's not really interested in like the structure of power, but basically the interaction between the people who make decisions and the rest of society. And so that is the end of chapter 17. For the textbook, the lecture highlighted also the voter participation and how that's important, and highlighted the forms of government, and authority as well. And it also stated no one coexists. It's fair. So then we get into chapter 18, which is work in the economy. And this goes into the economic system, starting with, the agricultural system that was based on trade and the trading of goods, like that. And then it goes into the industrial system and the effects that the Industrial Revolution had on the economy, and post-industrial capitalism, socialism, and it also pointed out convergence theory, and that is like when a country's economy grows, the organization of society evolves to that of an industrial society. And so the lecture highlighted mechanical and organic solidarity, and how mechanical was like more cohesive. I think that was the example used there was, in hunter-gatherer times, and then it moved to organic solidarity with the agricultural revolution, and how the agricultural revolution shifted to industrial with technology. And it also highlighted capitalism and how it's a profit-based system, and the U.S. has integrated European socialism into their capitalist form, and how socialism is government-owned, and the issues with unemployment and poverty, and how that is what's seen as like the complexities of living. And so the theoretical perspectives in chapter 18, we'll start off with functionalism and how they view work in the economy as a machine, and social stratification is necessary and for the continued health of the economy, and therefore important to national health. And then the conflict theory perspective on work in the economy is that economy is not a form of stability for a society, and it reflects inequalities. And so the symbolic interactionism theory behind work in the economy talks about career inheritance and how children tend to enter in the same occupation as their parents, and also looks at the contributes having to do with the satisfaction in the job. And then it goes into globalization in the economy, and the integration of government culture and markets because of trade, and the aspects of globalization and how, ancient societies traded with each other, and it's not really anything new. And it highlighted the benefits and the drawbacks, and among the benefits is like a potential for increased wealth for a country, but the drawbacks could potentially bring negative impacts to the environment and like the local economy. And then work within the United States. I highlighted that the American dream was more opportunity-based, and the polarization in the workforce, and how geography, race, gender, ethnicity, and things of that nature have always played a factor in your success in the workforce, and also highlights the job market gap, and which is like, if you have a high skill, you get higher paid. You get higher pay, but if you have a lower skill and you get a low skilled job, then it's lower pay, and keeps you in the lower working class. So that is chapter 18. Chapter 19 is something incredibly important to me, and that's health and medicine within sociology. I want to be an epidemiologist, so this section was made for me. And it goes in to talk about the social construction of health, and how a major topic in medical sociology is that there are also social determinants of health, and illnesses and disease, infectious, non-infectious, all of that have biological components, but it also has outside components, which is like the social determinants of health. And and chapter 19 highlights the stigmatization of illness, and it has a huge effect on the quality of care, and the kind of care that a person receives. And in the textbook, I think it highlighted the stigmatization of HIV and HIV patients, and how a lot of healthcare institutions often are discriminatory against them because of the fact that they have like HIV or AIDS and stuff like that. And then so then it highlights global health and social epidemiology, which is the study of the cause and spread of non-infectious and infectious diseases. And this particular grouping of epidemiology, social epidemiology, is focusing on the social determinants in health. And this section also highlighted that the health in high-income nations is linked to the rise in obesity, and the problems that come along with that, like heart problems, cardiovascular, diabetes, stuff like that. And then the health in low-income nations, there is high infectious disease spread, and they have a high infant mortality, low healthcare personnel. So there's that. And then they also don't have access to adequate water and sewage systems. So that also plays a part. And so for the lecture in this section, it highlights gender and health, and that is in terms of access to reproductive health outside of prenatal care and stuff like that, and the challenges of disabilities you can't see, and access to healthcare and how low-income healthcare needs to be better and good. And so that is some highlights of chapter 19. And it also goes in to talk about health by race and ethnicity, and how there is huge disparities and discrepancies between healthcare that white people receive and other races, and that's due to having poor quality healthcare, and health by socioeconomic status, and how that overlaps with health with race and ethnicity. And also in the textbook highlights health by gender and unequal access, and how, women are more likely to experience sexism in healthcare institutions, and then also highlights mental health and disability, and how disabilities are stigmatized. And then it goes into the theoretical perspectives behind health and medicine and functionalism, and views health as something that is essential to the stability of a society, and looks at illness as a form of deviance, because they are unable to fulfill their role in society and function. And the conflict perspective highlights that the issues within the healthcare system is rooted in capitalism, and that health disparities are created by class inequalities, and that means that low income, poor class is more likely to experience sickness and illness and things like that. And obviously then there's symbolic interactionism, and that is talks about how health is something that is socially constructed, and that history's view of society's view in history, and how deviance in medical, bad behavior turns into sick behavior, and then demedicalization, which is when sick behavior is normalized. And that's just the example used in the textbook was societal views on alcohol and alcoholism, and it talked about the when alcohol was banned, and so there's that. And then so that is the end of chapter 19. Chapter 20 is population, urbanization, and the environment. And this is something that highlights populations and in the study of populations, and the demographic theories, and how they refer to population growth and mortality and morbidity and fertility and migration, immigration, and things like that. And then it goes into urbanization. And this is the study of social, political, and economic relationships in reference to cities, and the relationships within those cities that surround that. And then it talks about the growths of cities and how, there has to be like good environments, technology, and strong social stability for there to be development in a city. And then it highlights that urbanization produced a increase during the Industrial Revolution because of job opportunities. And so during the industrial era, there was a growth spurt, and that growth spurt, you see cities like Tokyo, New York, and London, and those metropolis areas. And then it also highlights the theoretical perspectives on urbanization and human ecology, which is the relationship between individuals in a population and their environments, whether it be natural or built. And then it also highlights the environment in society and how climate change has affected the population because of human activity. And you saw an increase in temperatures due to that. And then pollution and how unsafe water can be catastrophic, and soil, and how soil erosion from an expand in agriculture affected the environment, and then garbage and air, smog, and then it also highlighted environmental racism, which talks about how a disproportionate number of toxic waste and pollution that minorities are exposed to in cities. And the lecture highlighted climate change, urbanization, growth of cities, and then it also highlighted gentrification, which occurs when abandoned areas get built up. And when those areas get built up, so the property value goes up, and this impacts water quality, chemicals, trash, and can cause a shift in the environment. And also highlights that economic and government decisions are based on demographics. So that is that for chapter 20. And then chapter 21, social movements and social change. I highlighted from the textbook collective behavior in the forms, the three forms of the crowd, the mass, and the public, and also the theoretical perspectives behind social movements and social changes, and the theoretical perspectives on collective behavior, which is like emergent norm, and that's how certain circumstances people respond to situations of crowds with their individual set of norms, which is more of a symbolic interactionism view. And then the functionalist view is the categorization of the crowd behavior, which is value added, and a lot of there has to be like conditions in place for the collective behavior. And those conditions include structural conductiveness, structural strain, growth and spread of generalized belief, precipitating factors, and social control. And I highlighted, the explanations behind those. And then chapter 21, talks about assembling perspective, which is just another understanding for collective behavior that focuses on the individuals in crowds, and talks about how collective behavior and puts a refocus on collective action. And then it goes on to talk about these social movements and the levels of social movements, like local, state, global, and the types of social movements, including, reform, which is just like wanting a specific change in the structure of society, and then revolutionary, which is like a complete change, and then religious or redemptive talks about more of like an interchange or growth in individuals. An alternative focuses on the self and improving the self. And I think the example that was in the textbook talked about dieting. And then resistance, which is an act of like preventing or undoing a change that happened in the social structure. And then chapter 21 goes on to highlight the stages of social movements and how social media has become something that has the potential to transform involvement in social movements, and how it hits all of the stages of social movements, like the preliminary stage, which is like awareness, the coalescence stage, which is like people joining together and publicizing it, and then the institutionalization stage. And then it goes on to talk about theoretical perspectives and resource mobilization, and that explains success in the movement to get resources or move individuals. And then it goes into frame analysis and how the concept of frame analysis is to use like 3 different types of frames to explain how people respond to social events and the norms they choose to follow. And then one of the 3 types of frames is like diagnostic, prognostic, and motivational, which the first one is referring to how the problem is stated and understood. The second refers to solutions and how it will be implemented. And then motivational, which is like a call for action. And it also highlights the new social movement theory, and that how it attempts to explain post-industrial and postmodern movements that cannot be analyzed using the traditional perspectives. And then chapter 21 also highlights social change and the causes, and that how technology, social institutions, the population in general, the environment, all cause social change in their own way. And then it also highlights modernization, and that is how, like, when there's more specialization in a society. It causes it to move from an underdeveloped to a developed society, and the movement is basically judged by their technology within that country or society. And so the lecture highlights in chapter 21 that the different theories connect to real life, but it can also fall into an idealized version instead of like a realistic thing. And that the lecture also highlighted that social movements are not an industry, so it can't produce quick results, and the way to improve people's lives is constantly work towards your contribution to what you want to change and improve and what you're passionate about, and to prepare for disappointment with how it might not change in your lifetime. So yeah, sorry I went over 30 minutes. And thank you for listening.